Hey guys, guess what? It's Angel and you're watching my latest video. Today's video is going to be a continuation in the series that I'm doing on mental illness, particularly dealing with my journey, I guess, dealing with my mental illness. And if you have not watched my previous 3 videos dealing with this, I would encourage you to go back and do that so that you kind of have like the full scope, the full story, whatever, and are kind of caught up. If you have watched the other 3 videos and they have helped you, that would make me so very happy to know that I have helped someone. If you've watched the last 3 videos and were waiting for me to come out with another one, and yeah, it's taken me a long time, I'm really sorry about that. I did not intend for there to be such a lag between my recording of the videos, so I apologize for that. But I did mention in my last video, I believe it was my last video, that I was going to make a video dealing with my hospital stay. And I want to do this video, it's kind of like a fine line of walking between like scaring you from ever going into the hospital to relaying to you the fact that if you do need to be hospitalized, if you do need help, it's the best place for you. And that was kind of my struggle during my hospital stay, is number 1, not wanting to be there, but number 2, realizing that it was the best place for me to be and that I had made the right decision by going in. And although it was, I'm not going to lie, it was an extremely uncomfortable experience. Probably one of the most uncomfortable experiences that I've had in my life. But it was also so very helpful, and I hope that I can put that across to you during this video, especially if you're someone that is suffering with mental illness. Because the prospect of going into the hospital scares a lot of people, especially I have friends that also deal with bipolar, who have been hospitalized, and some of them hospitalized for a much longer period than what I was. I was in the hospital for 5 days. 5 days may not seem like a long time, but when you're in a psych ward, 5 days can seem like an eternity. And I have a friend who deals with bipolar who was actually hospitalized when she was 16, and she was in the hospital for 7 months. I cannot even imagine that. My mind can't even go there. But I don't want for people to be afraid of going into the hospital if that's what you really need, because that's what they're there for. And I think I had in my mind, I don't know what I expected. I mean, you watch movies or whatever about people that are in psychiatric wards dealing with mental illness, and I don't know what I really expected. I think that initially I expected that when you go into the hospital because you're in a bad mental state and you're extremely anxious and you need help, I pictured in my mind that when I went in, they would like give me warm blankets, and that they would be, very, very much like, it's gonna be okay, like very calming, and like, and for the most part they were calming, but don't expect the warm blankets. At least in my case, that did not happen. And I'm not really sure what they do is effective. What they do is very effective. And there's a reason I am sure there's a reason to everything that they do, from the time that you get there to the time that you're discharged. It's just not what I expected. I'll be honest. But to get right into it, and I don't want to go into, I don't want to over dramatize why I went. I don't want to get into the details, but as far as like, well, and I'll just suffice it to say that the reason that I went was because I had been having terrible bouts with suicidal ideations and suicidal thoughts. And I had been struggling with this for a good 6 months. And it wasn't the first time I had struggled with this, but this was certainly the most severe, I would say, the most severe. And I've kind of addressed a little bit of what I dealt with in some of my previous videos, but at this point, I had been visiting with my counselor and my prescribing doctor on a weekly basis. They were fully aware that I was having these thoughts. They were doing everything that they could. I believe they were doing everything that they possibly could for me, or everything that they thought they could do for me. They had given me a safety plan. They had instructed me to call them at any time if I needed them, or to call the hospital, or to go to the hospital, or to call the crisis line. Whatever it was that I needed to do, they instructed me to do it. This particular night, I had decided that that I was just done. It's not that I necessarily wanted to die. I just really didn't want to live anymore. I just really didn't. The thought of going on just was a burden to me. I just felt like I could not do it. My husband was traveling for work at the time, as he does very frequently. That's just the nature of his business. And I believe he was in Philadelphia or something at the time. We were living in the Seattle area. My son was home. My son was 20 at the time. He had just turned 20, and not just, I had been 20 for a few months, not that that really matters, but my son knew that I had been struggling with depression. He knew my diagnosis. We had talked to the family about what was going on and what symptoms I was having and things like that, but we had not talked about, I had not discussed with my son. Now, I discussed it with my husband, but I had not discussed it with my son, the fact that I was having suicidal thoughts and ideations. This particular night, I had been thinking about a plan for a while, and this particular night I had decided this is it. I can't do this anymore. And I won't, like I said, I won't go into the nitty-gritty details, but I will just say that that I had lots and lots of medication that had been prescribed, and a lot of it that I was no longer taking, but I had just not bothered to get rid of. And I chose one of those medications and Googled what a lethal dose would be, counted out the pills. I had more than enough, and that was going to be my method. And I was going over it in my head and going over it, and it boiled down to this. My son was working an overnight job at the time, where he would leave at about 9 o'clock at night and not get home until 3 or 4 in the morning for work. And it boiled down to the fact that my son was going to be the one that would find me. And I could not do that to him. I couldn't. And I decided that I needed help. And at that point, it was about 8 o'clock at night, about an hour before he had to leave to go to work. And I came downstairs and I was crying. I was pretty distraught. And I had packed a bag upstairs. For some reason in my mind, I had in mind that if I went to the hospital, they were going to hold me for 3 days. And so I had packed a bag with 3 days worth of clothes. And I had decided, okay, I'm going to drive myself to the hospital. I need help. So I went downstairs and informed my son of what was going on, and then the next thing I had to take care of was getting someone to come and let my dogs out, because I wasn't going to be there. I usually let them out about 10 o'clock at night, right before I went to bed, but I wasn't going to be there because I was going to be going to the hospital, and my son would be at work. And so I called my neighbor, who was a close friend. She was very aware of what was going on with me. She knew my struggles, and she checked, she was very good at checking in on me, and just a very, very good friend. And I asked her, I said, can you please, come about 10 o'clock and let the dogs out for me? And she said, what's going on? Is everything okay? And I said, no, it's not okay. I said, I'm going to go to the hospital tonight, and Brooke will be at work. And she said, is your husband home? And I said, no, he's not home. And she said, I'm going to be right there. I'm going to drive you. So she and her husband actually happened to be my bishop at church. They drove me to the hospital. I got to the emergency room and told them that I was suicidal. They got me back to a room. It was an intake room, and where if you've been to the emergency room, they take you to intake. They do your blood pressure, all this stuff, whatever. And so they did all of that, and then they had me stay in that room. And I was in there for a good while before they came back in, and they said, we're calling around, but nobody has. They were basically calling around to different psych wards in the area. The particular hospital that I was at, they did have a psych ward, but all of the beds were full. And so they said, we don't have a bed for you here. Everybody else is full as well. They said, we're going to have you stay here overnight in this room, and hopefully there will be a bed that opens in the morning. So sure enough, in the morning, fairly early, they said, there is a bed that's opened just north of here. We're going to transport you. And so that's what they did. They transported me in an ambulance. I went to another hospital, went to their behavioral health, psych ward, whatever you want to call it. They checked me in. They took my bags. They took all of my belongings. They went through them. Anything that they deemed that I would possibly be able to hurt myself with was taken away from me. At the time I was wearing a jacket that had a little drawstring in the bottom of the jacket. And they gave me an option. They said, you can either keep your jacket and we can cut out the drawstring, or we'll have to take your jacket from you. And they also did that with my shoes. They said, you can have your shoes without the laces, or you can have these little hospital booties. And I just chose to wear the hospital booties because I just didn't feel like clunking around in my Vans without shoelaces. I had them cut out the drawstrings. I wanted to keep my jacket. And that was, they took me to my room, which was very bare, very stark. No pictures on the walls, no TV, no phone, no radio, not even I don't even believe there was a nightstand in the room. There was a bed, there was a chair, there was a shelf on the wall that I could set they let me have my clothes, like my underclothes and my regular clothes, but everything else they took from me. So I set my clothes on that shelf, and I sat down on the bed, and I thought, what in the world did I get myself into? I want to go home. But at the same time, I didn't want to be home, because I knew if I was home, I was gonna hurt myself. And it was just a very, very uncomfortable feeling, very uncomfortable. My anxiety was at the highest that I could imagine that my anxiety would be at. I was in a new place with people I didn't know, and nothing familiar around me, nothing comfortable around me. They had somebody, one of the caseworkers or one of the counselors, I guess, came in. They did an assessment on me, where they asked me questions about what symptoms I was having, things like that. The symptoms at the time that I listed were depression and hopelessness, manic symptoms, anxiety and panic, and obviously that I was, suicidal. And then they gave me a booklet, which looks like this, patient workbook booklet. It has, if you open it, it has a list of the program, the staff, rules, expectations of patients, visiting hours, dress code, meals, what they do with your valuables, They take your valuables, they lock them up, they have a security guard come down, they take them, they sign everything out, you have to sign it. They take those things and lock them up from you. And then they basically say, they tell you what's going on. They say, we eat at this time, and this time. The menus are by the phone. There's a phone over by the nurse's station. You're allowed to use that phone. They want you to keep the calls down to like 10 minutes, so you are allowed to call your family. And people are allowed to call in and leave messages for you, so you can get those messages and then return their calls. There was a central room that had like a kitchen and tables. They had magazines in there, but the magazines were so old and so tattered. I mean, they were like a year or two old, some of these magazines. They had, the only real thing that you could do to like entertain or pass time was they had card games or regular games that you could play with the other patients if you felt comfortable enough to do that. When you don't know anybody and you know that everyone in there is in there because they're in a bad emotional place, you don't really make friends very quickly. And so they did have like watercolors, they had crayons if you wanted to color. That was about it. And then you have group meetings, and the group meetings are mandatory. And when you go to the group meetings, they teach you tools of how to recognize and manage your symptoms, how to manage your life, which is very, very helpful. I know that sounds really silly that you would have to go somewhere to learn how to manage your life, how to take care of yourself, but when you deal with a mental illness, those things are not always things that you just think of automatically, especially when you're in a bad place. So they give you lots and lots of, I just have pages and pages of workbook things that we did in the different classes, and these were all super, super helpful to me. They would go over, they gave me a list of positive self-care things. Eat and drink sensibly, assert yourself, stop smoking or other bad habits, exercise regularly, reduce stressors, just all kinds of things. Then I got so many tools in there. It was very, very helpful. It was the right place for me to be at the right time. They also gave me, I found this very, very helpful, and I just came across these recently, but mood charts to fill out during the day to track your moods, especially if you're bipolar. You're not always aware if you're hypomanic. You're usually aware if you're depressed. But hypomania is something that, you're feeling so good, you think, there's nothing wrong with me. I'm feeling great. Or if you're super, super agitated, you may not realize that you're experiencing manic or hypomanic symptoms. One of the mistakes that I made when I was in there, I did not read the rules right away. And I didn't see the doctor the first day. It seems like the doctor came in the next morning or the next afternoon is when the psychiatrist came in, and I saw him every day after that, and I credit that psychiatrist with, he put me on the Seroquel, which has been very, very effective in treating me, and I am so grateful to him for doing that. He is the one that told me, he is a psychiatrist that told me that there were only 2 medications that had been proven over the years to effectively treat bipolar disorder. And those 2 medications were Seroquel and Lamictal. And he chose to put me on Seroquel. I don't know if Lamictal would be just as effective in treating me or if it would not, but I know that the Seroquel has worked really well. One of the mistakes I made was, this is probably going to be a 2-video thing, or I'm going to have to record because my memory card's going to be up here. I didn't read the rules right away, and one of the rules is patients are not allowed to go into the rooms of other patients. And there was a young girl that came in shortly after me, and she was very, very distraught. She was about the age of my son, and so when I heard her crying and screaming, and she was in her room and she was screaming, I don't want to be here, I want to go home, I don't belong here, and She was so upset, and she just, and my motherly instincts just snapped in, and I just immediately wanted to go to her and comfort her. And so I went to her room, and I went in her room, and I was like, are you okay? Are you okay? And one of the counselors came in, and she very abruptly was like, what are you doing in here? You are not allowed in another patient's room. You need to get to your room right now. And it shocked me. And that happened the very first day that I was there, and I realized, okay, I need to read the rules. I am in a controlled environment. I am no longer at home. I no longer have the ability to do whatever I want whenever I want. I'm in a lockdown situation. My belongings are locked down, and that's the first time I realized that I was not in control of my situation. I was very, very uncomfortable. And so really, really quickly, I'm going to try and summarize just some of the things. If you go into a psych ward, they're going to remove everything from you that they feel like you can hurt yourself with. Your room is going to be very, very bleak and stark. There's not going to be there were no hooks on the walls to hang anything. I was not allowed to close the door to my room. They have to have a line of sight to you at all times to make sure that you're okay. There was no lock on the bathroom door. I did not shave for the full 5 days that I was in there when I showered, which is really, really, really gross. But in order to shave, they don't just give you a razor. They come to your room, they watch you in the shower while you're shaving yourself, and then as soon as you're done, you hand the razor to the worker, they take the razor back, and then they leave you. I did not feel like I wanted anyone watching me shower, and so I chose to not shave while I was there. So you're going to be very restricted, but it's for your safety, and they're going to teach you things that are going to help you years and years down the road. And if you're in a situation where you are unsafe to yourself, that's when you need to be there. That's when you need to be at the hospital. And that's when they can help you. I just want to let people know that I've said it like a million times in this video, but the hospital can be a scary place, but it is a very helpful place if that's where you need to be. And so if you feel like you're a danger to yourself, please go to the hospital. And some people don't have an option. Some people, for instance, if you're bipolar and you experience psychosis, which is not something that I experience with my particular bipolar, but a lot of people with bipolar do experience psychosis. And if you are experiencing that, you may end up in the hospital without even knowing that you're going to the hospital because your loved ones or whoever finds you may admit you. But just know that you can learn a lot from the experience, and they're there to help you, and they're there to give you tools to help manage your life and manage your symptoms, and they're very, very effective at doing that. And I'm very grateful to all of the workers that dedicate their lives, all the counselors and doctors that dedicate their lives to helping people deal with their mental illness. I'm very grateful to those who've helped me. So I'm going to go ahead and wrap this video up. My next video that I record, I will probably deal with a few more things of my hospital stay, just like my experiences meeting other people and things like that. But I want to focus on what my life was like when I came home from the hospital, because I don't want people to be under the illusion that when you are discharged from the hospital, everything is better and you are great and you're healthy and wonderful and life goes on and blah blah blah, because it's generally not the case. Generally you're discharged and they'll make sure that you're in a safe place, that you're not going to try and hurt yourself or anything like that. And obviously if you're psychotic, they're not going to discharge you until after your psychosis has ended and you've returned to reality and you can deal with life. But when you get home from the hospital, there are a whole range of other things that come into play. And so my next video will be dealing with that experience and what it's like to be an adult who, I love my spouse very much, and he is very, very supportive, and he has helped me tremendously. But oftentimes, sometimes I feel like he's the parent and I'm the child at this point in our relationship. And so I want to kind of discuss some of those things. And there's an article that I read online that deals with that from the caregiver's point of view, from the husband's point of view. And he talks about how he has dealt with being the caregiver of his wife, who has spent 2 times in the psychiatric ward. And it was a very, very good article. And so I'll discuss that in my next video, and I'll definitely put a link to that article in that video so that you can check that out for yourself. But for now, I'm going to close this, and I just hope that you are living the best life that you can live. And if you're dealing with mental illness, or you have a loved one that is, just know that you're not alone, and know that there is hope. And there's not a cure, but there are good treatments, good effective treatments that allow you to live the best life possible. And I just want to encourage you that that is a reality, that you can live with these diseases, and that you can live as good a life as you possibly can with the right treatment and with the right support system. So anyway, I hope this video finds you well. I hope you guys have a great week, and I hope you have a great day. It's obviously at night right now while I'm filming, but hopefully you'll have a great day tomorrow. And until next time, I will talk to you later. Bye.